Somebody's on here already. I'm just going to wait a couple of minutes till hi Donna, how are you? Hey Blaine, thanks for tuning in. Hey Josh, I'm just going to wait a couple minutes. Hey Don, nice to see you. Scott, how you doing? Jay, sorry I couldn't talk, I just don't have it. Shirley, hey, thank you for the kind words. Hey Paula Smith, nice to see you. Ingrid, oh my friend. Terry, so good to connect with you, brother. Kathy, love you to pieces. Lisa, I'm just going to wait just a few minutes to get just a couple of minutes. My nurse will be making her rounds with me in around 8 o'clock. So, hi, Gary. Nice to hear from you. Chris Cavazzi, thank you. Hey, Terry. Yukon, my buddy, I miss you. Wanda, always great to see you. Tony, oh man, this is great. Hi, Patricia. Thanks for the prayers and thinking of me. Karen Caseman, love you. Susie, hey, Dave. This makes me feel better. Bink BP, nice to see you. Nikki, my babe, all right. Paula, Sheehan, hi. Chris Kushner, thank you for tuning in. Barbie, I'm going to give you, we're just going to wait just 2 more minutes. Tracy, how are you? Chuck, nice to reconnect with you. Robert Ford, my buddy. Tiffany, how are you? Nice to connect with you. Hi, Julie. Angie, good to hear from you. Thanks, Wanda. Holly, it's good to see you on here. Julie, thanks. I don't feel so good, but Barbie, it's great to hear. It's just great to have you on here. Jackie, thanks for connecting and all the prayers. Janet, Lisa Anderson, Malacarney, thank you. Appreciate it. Well, we have quite a few on here right now. So, Marianne, Joni Peters, hey Gina Kersey Arnold, appreciate it. Linda, I appreciate the prayers, Linda, and the thoughts and everything. Denise Sawatsky, thank you so much. Hey, here's my brother, Dave Piccirillo, man. He's been my rock through this whole thing. Mary Curtis. Hey, Mark Isaro. Got a chestnut for you, dude. Kimberly Asti Fritz. Trish Dahl. Thanks for connecting. Michael, so glad to see. Yeah, I'm not quite well yet. Kenny Wayne. All right, Angela Neal. Patricia. All right, well, I got to stop saying hi, and I want to get to what I've gone through. I've had this thing for 2 weeks now. I'm a little labored breathing because, I've gone through some pneumonia, and I'll tell you about the treatment protocol for that. Hi, Lillian. Mike Perry, good to see you, buddy. Lisa Walters, thank you. So what happened was I started with this thing. I don't know where I picked it up. They opened Florida. I will not get into the political end of this because everybody's got an opinion. What I'm trying to do is provide information about COVID itself, because this is the nastiest virus that I've ever come across. I remember seeing Joe Rogan's podcast mid-March where he had an infectious disease specialist on here. And this guy predicted, he said, this thing is 20 to 40 times worse than anything we have seen. And he's right. I've never been so sick in my life with a virus. I don't know how I contracted it. I did the self-quarantine. The only place I went to were the grocery store and the chiropractor for weeks on end. Now, in the grocery store, a lot of people didn't take it seriously. They weren't wearing masks. They weren't social distancing. this is one thing that is across the board that you should be doing. Wear a freaking mask wherever you go, especially if you're going into a store. If you're in an open space with no people, I don't think you have to worry. It's not that airborne. I'm going to be wearing a mask everywhere I go, outside, inside. My doctor told me to do that because this thing is deadly. And there is a high survival rate for it. But if you have underlying conditions, I've got some high blood pressure, low, high range. It's a genetic thing. Both grandfathers, my dad have it. And it's spiked. But let me just get to that. How I got it, I have no idea. I did go to my favorite karaoke place once they opened up Florida twice. I'm not going to name it because I don't want to get any businesses in trouble. They're just doing what they're supposed to do. But I know one of my friends that goes there says she knows of 20 cases of her friends, of people that frequent that place. I could have gotten it there. The weekend before I got this, I did 2 birthday parties in Tampa. One was in a big house with very few kids, maybe a dozen kids, and a few adults all spread out. I was close to some of them, though. The next day, I did one in a walk-in closet-size apartment with about 2 dozen kids and another dozen adults. Could have got it there. I could have got it at the grocery store by touching some of the things and then not washing my hands afterwards or whatever. I don't know where I picked it up. All I know is this thing is all over the place. It is probably not as bad in the rural areas, but I know we've seen a spike here in Florida. I also know the numbers are skewed. This is the only part of the political I'll get because I've talked to paramedics, the doctors, everything. There are people diagnosed with terminal illnesses, cancer, leukemia, things that are, or not even terminal, they die of those things, but because they have COVID is counted as the primary cause of death. I don't know why that is. Also, there are about, a paramedic told me there's about 50% false positives on this. Now, mine is a definite positive and very abnormal. And how I started was that weekend, it was June 8th. I did the parties on the 5th and the 6th. The 7th, I was really wiped out. On the 8th, it started with extreme fatigue, extreme headache, body ache, and I didn't really have any respiratory. Now, you have to understand that COVID-19 is a respiratory illness, okay? So there's other things, but what's something about it is when they asked me about this, there are lower abdominal issues. A lot of people, a huge number of people are coming in with diarrhea, nausea, vomiting, so that can be part of it. I haven't had any of that. I've had the upper. And I had no idea, but what they diagnosed me with and why I was admitted. First of all, I came to the hospital last Tuesday, the first time, because I was feeling so bad, I couldn't care for myself. They ran a battery of testing, including a COVID-19 test, and they just sent me home. They said we could keep you here, but you'll be more comfortable at home. Well, 2 days later on Thursday, I was feeling very, very sick in the afternoon. I thought I was feeling better. By about 2:30, I went down, and I really couldn't function. So I called the paramedics again, and they took me to Northside Hospital, where I'm at, and the care is incredible here. Although I did get a little pushback from the paramedics because they were kind of overwhelmed. There's 3 major hospitals near me in St. Pete. 2 of them were diverting, which meant they weren't, they would take you, but they couldn't do a whole lot. But Northside, because I'd been here before, they took me, and then they admitted me because they found out that I had pneumonia. It wasn't a really bad case, but I did have pneumonia. So they immediately, I slept in the ER until about 3:30 because they have a COVID ward here, and there's quite a few beds. but a bed didn't open up till about 3:30 in the morning, and I came up here and was made comfortable, and they gave me a Z-Pack, 2 pills there in the emergency room, and another antibiotic trying to attack the pneumonia. And I didn't feel that bad. I mean, I felt really wiped out, still had body aches. I just could, and just parched. I couldn't hydrate enough. It drained me. So from there, the next day, my cough started getting worse. So the pneumonia was progressing. This again is very similar to SARS, which happened a number of years ago, if you remember that pandemic. And it's very similar to that. So what happened was they treated that, and they decided the next day. In fact, a friend of mine, Phil Bernard, who owns Magical Meat Boutique, sent me a message. Thank you, Phil. I don't know if he's on here or if he's watching. That he sent me a message about a steroid that is being used in the UK it's a life-saving steroid, very successful, that they give for respiratory. What it does, it cuts down on the inflammation, opens the breathing passages. And so I have a hospitalist here that is my doctor that oversees me, but I also have a pulmonologist. And the next day that pulmonologist said, I'm going to give you this, I've named it before, it's dimethicillin. It's a steroid. You'll see it. Look in my feed, and it's very effective. And I was been very tired. They gave me a shot of that. It's an IV, and I took 2 hours later, woke up, and the cough was gone. I could breathe easier. It had stimulated my appetite, and they gave me another shot at night, and they've been giving me 2 shots a day of that. Now, the biggest downside to that has been the fact that it will raise the blood glucose extremely in your blood. So in other words, your blood sugar goes way up. The typical level should be between 7 and 110. Mine was around 279. So what they had to do is give me a shot of insulin, which really stimulates me. Now I've got Tourette syndrome. It's not considered an underlying condition. The high blood pressure is. The steroid has elevated that, but it's manageable, and they're able to bring that down also. So there's a lot of stuff they do. There's no cure for COVID-19. What they're doing is taking care of the symptomology of whatever you're going through so that your body can take care of the virus. That's why, with most viruses, you have antiviral drugs. A lot of them will respond at the very beginning, but once that virus goes into the cell, the myelin sheath of the cell, and I learned this in college, the immune system can't see it anymore, and antiviral drugs are no longer any good. But there's no antiviral drug that they know of that battles this. Now they're having success with resmendivir. I forget. I'm not pronouncing that right, but this particular steroid, because it's hitting the respiratory system, which is what this virus is all about, is very effective. And it was very effective with me. It's given me a little more energy. You can tell my voice is not quite up to what it should be. I haven't moved around a lot, but I've been doing range of motion exercises in my bed, stretches. My doctor recommended that. I have more energy. They're talking about a discharge date. He's going to get with my pulmonologist, because I will probably feel better convalescing at home. Although it's very quiet here at night and I'm getting amazing care, in the next couple of days I will be ready to go home. I think I'll have the energy to be able to lay in my own bed, move around a little bit more, and heal better. So remdesivir. My brother just pointed that out, remdesivir. I forgot about that. And they're having a lot of success with that. Now, the other stuff, Dave, you might be able to help me with that. What is it? The quinine, it's got quinine based. But they thought that was a good one. Not sure what that is. Dave, my brother might put it up there again. It's there's a lot of side effects to that one. It was considered a good drug, but now they're not using it a whole lot. Sorry, I'm not bringing anybody into my video right now because I've only got I don't have that much time. So yeah, well, thank you for saying some nice things, folks, and everything. So what have I learned? What they do is they attack the symptoms. They really, everybody, from what I can tell, presents differently. Tom Hanks, when this first came out, him and his wife both got it in Australia. He got it very similar to me with just a huge amount of fatigue. I've never been so fatigued in my life. I too fatigued to watch TV. I couldn't function. I had to continually hydrate, constantly dry. I had no kidney problems, thank God, and there's no kidney damage. But I urinated continually. So, and thank you, Lauren. People have made me feel very loved. I want to say that right now, that this is what has sustained me. Aside from my family and a couple of close friends, I go to Facebook because you've just filled it with love, and you have no idea what that connection has mean to me. Because I'm down here alone. I'm not allowed to have any visitors. I have friends in the area, but nobody can see me. Nobody can come in here. I haven't felt alone because of you folks. And you'll never know how grateful I am. Now, the reason I get a little emotional is I've been on, vitamin D3. It's a co-occurring condition, a little bit of depression, dysthymia. It's actually dysthymia. It's a low-level depression. It's a co-occurring condition with the Tourette's. And I do 5,000 IUs of vitamin D, which they found also is very effective in building the immune system to prevent getting COVID. So if you can do that. But I haven't been on that for a week, and I told my doctor, that's why I kind of lost strength last night. I didn't sleep too well. They have me hooked up to a monitor that monitors my heart rate, my blood pressure. It takes my blood pressure automatically every 2 hours, my heart rate, as well as my oxygenation. So my oxygenation is how much oxygen I'm getting to my brain, is still very high, 96 to 98, which I haven't done a lot, there hasn't been a lot of damage. So, Marilyn Nidopudu, thank you. I'm allowed to be emotional. Thank you. Andre, it's nice to see you. So the bottom line is people get it differently. Tom Hanks had just extreme fatigue. He would go down. He has a 20-minute stretching routine. He said within 12 minutes he was just exhausted, had to go back to bed and slept, right? Other people have the nausea, vomiting. Other people, the lungs are weakened, and it gets to the point where they have to be put on oxygen, and the oxygen doesn't work, and that's when they have to be intubated. And the intubation is being put on a ventilator. And I read about that, and it's not fun. They basically put you in a medically induced coma and run a line down your throat so it breathes for you. And the chances of coming out of it, some people do and some people don't. Some people die from it. If you get to that point, you don't want to get this, folks. You do not want to get this. I don't give a shit what the politicians or what the media is saying. Go, if you're gonna err on the side of freaking fear. Okay, please do that, because this thing is horrendous. So do what it takes. If you have to isolate, now granted, I'm not going to get into the economy. When that all came out, I understand it. America isn't built to shut down. With the economy, if it shut down too long, then we'd have there would be break-ins, there would be more deaths, there would be martial law. I get it. I totally get it. All I'm saying is you don't want this damn thing. This is the worst thing I've ever gone through. I've been through mononucleosis. I've been through, if you read one of my feeds, about 18 months prior to getting diagnosed with Tourette's. It got so bad when I was 15, 16 that I was ticking 20 hours a day, chewing holes in my cheek, horrendous pain. I ground my front teeth out of my mouth. I couldn't stop jerking 20 hours a day, 4 hours of interrupted sleep. My body was going crazy, and they had no idea what was the matter with me. I went through a battery of tests and finally got diagnosed and on some medication. It was hell on wheels, but it was still, that 18 was a cakewalk compared to these last 2 weeks. Take it seriously. Wear a mask. Wash your hands a lot. Protect yourself. Social distance. Stay the fuck away from people. Okay? I can't stress this enough. I don't care what you're hearing or what. I never thought I quarantined. I did everything that I thought I was doing right. Do everything you can to prevent getting this. This thing can kill you. I'm 60 years old. The only thing that has saved me, I will tell you that right now, the only thing that has saved me, I believe, is that around 10 years ago, I decided to get, well, actually it was probably less than that. I was 40 pounds overweight when I left my last marriage. 6 years ago, I said, enough, I'm getting in shape. I was 40 pounds heavier. I started eating right. I was eating clean. I still continue to eat clean. I work out. And that is what saved me, is that I'm in pretty good shape. So people with underlying conditions, if you're obese, you're automatically at risk for more complications for this. If you have high blood pressure, like I do, that can be managed, but any kind of underlying conditions that you have control over, take care of those. And if you can't take care of it, stay inside, quarantine, stay away from people, stay away from trying to get the virus, because I cannot stress this enough. I've never been sicker in my life. I'll tell you what, it was only up until a few days ago that I either wanted to die or I wanted to get better. And I didn't care which one. That's how bad it was. So, and thank you, Wendy, for, I know I'm going through it. There's people that have died from it, and there's people that are still going through it. I haven't left my room. I'm not allowed to leave my room. I've been here since Thursday night, and this is just what I have to do. And I'm glad I'm here. I'm glad I have my healthcare team is crack. My pulmonologist has been practicing 25 years. He's so caring and compassionate. My hospitalist is just amazing. Also, Dr. Santos. My pulmonologist is Dr. Middleman. I've had different nurses. They do 12-hour shifts. They're working the heck out of them. They rotate them. I haven't had the same nurse any day or any night. They've all been stellar, highly trained, compassionate, caring, very responsive when I call them. Most of the time I'm still a little too tired. I might watch an hour of TV a day. If I spent more time on Facebook today than I ever have, because I've had the energy. I still don't particularly care for messages in Messenger, because it tires me out to text folks. And I apologize for that. And I'm really sorry about that. But it just tires me out sometimes. That's why I have to tell you, I'm not trying to be rude. It bums me out that I have so many beautiful comments from you people, and I can just give you a heart. That hurts. Because I just want to tell you how much I appreciate it. You have no idea. The kind thoughts I've heard from people that I haven't heard from in years that have been on my friends list. It means the world to me. It means the world to me. So that heart means everything. What I said. Sorry. Lack of vitamin D. But that heart that I sent you means everything for me. And the kind comments. I feel so loved, so cared for, just because of you guys. You have healed me more than anybody. Oh, you have been my saviors, whether you know it or not. The healthcare people have been great. They're doing their job to get me together physically. You keep me boosted emotionally, continually. I can't tell you enough. There's been people sharing to their groups that I haven't even known. Do you know how many friend requests I've gotten just in the last few days? Probably an average of, I've gotten at least 75. I'm so grateful. I'm just full of gratitude. Grateful to be alive, grateful to have such good friends on here. A lot of you I don't even know, but I know you now, and I know how you have restored my faith in humanity, which I was losing through this year, because I see it's a political year, and there's a lot of, the nation is divided. I haven't seen it as divided since the Vietnam War. And then we had the, George Floyd killing, and that screwed everything up. But things like this, you came through, and you showed that people are good. And I appreciate that. And you can't imagine how much that you restored my faith in humanity. I have a trip scheduled to Ridgeway in August. I'm supposed to fly up there August 1st. I was going to stay a week. I don't know if I'm going to make that deadline, if I'm going to be well enough to do that. But when I do come up, I'm kind of on a different trajectory. I've been talking about this for years. I've been through a lot of adversity, but I'm finally going to write my book. And I'm going to be putting out probably some virtual, a course on overcoming adversity, because I've kind of become an expert at it. If you knew what I've gone through in my life, I talked about the Tourette's and the COVID. There's been other things. And so my job is not about ego and telling you how great I am to overcome this. I want to show other people how to overcome any adversity. And the biggest thing that it's done, that I've learned through this whole thing, is that it's not so much, even though this thing devastated me physically, it's a mindset, folks. And that's why I wasn't lying. 95% of my time, I just have hope. Whether I was on Facebook, which you guys helped me a lot, but I cultivated that positive attitude and about what could be, and not about, and I've had coaches along the way like Nori Love, like Trisha Ann, that have helped me, like Patricia Simone. These are coaches that have got me on a spiritual path, not to mention my 12-step friends. I've been in recovery for 20 years. I don't want to give away their anonymity, but they've helped me. It's about a mindset. The only time I thought about death was one time for just a few minutes when I went down prior to coming here the last time to the emergency room. I thought, I thought I was getting better. Am I going to die? But after that, death is not an option. You can beat this. You have to keep it positive. That's any adversity in your life. It starts with mindset. Starts with mindset. I keep negative people out of my life. I don't want fear-based thinking. I don't like to listen to it. I don't like to hear it. I only like to say, and I've had so many people on here saying, you're going to get through this. You're tough. You're strong. And they're right. They're absolutely right. They think like I do. The mind controls the body to a large degree. And that's what I've learned. And Brad Crone, that gratitude. See, that is a tool that I use daily. Grateful for what I do have, not for what I don't have. I could be a lot worse, folks. I could be a lot sicker right now. Yes, I'm feeling pretty bad right now, right? But I was a lot sicker only just a few days ago. I was a lot sicker 2 weeks ago. So I'm grateful for that. I'm grateful for you. So there's certain tools that I use to get through this. And my brother said that. Dave said, sometimes when you think you're at your weakest, you're really at your strongest. Exactly. It's got me back. It's got me closer to God. And you guys keep reminding me through prayer and give it to God. And that's what I do. And sometimes I give it to you to give it to God. So I use everything at my disposal to beat this thing. And I will beat it. I can tell you right now, I'm on my way there now. I'm feeling better. You're a huge part of that healing, and I'm grateful for it. So, can I ask you, let me just look at my time because I can't see what time it is on here. It is 8. My nurse can come in at any time now. So does anybody have any questions? The glass is always half full, right, Karen? That's exactly the way I want you to look at it. It's how I always look at it, right? It's kind of like when, back in my drinking days, they'd say, well, when life hands you lemons, make lemonade. No, I said, when life hands you lemons, you grab a bottle of tequila and I'll get the salt and we'll get together, right? So, do you have, Mom, Dad, and I are so proud of you. My mom and dad are my rock. They just support me through everything. 87 and 91 years old. They're in great shape. They're sharp. They support me like my brother. My family is just my rock. They're just amazing people. Anybody that knows my mom and dad know how special they are. Thank you, Mom and Dad. And Chris Kushner, you will beat this. Christine, she's a highly credentialed RN, psychiatric nurse. She knows. Dave Schneider, keep me laughing, buddy. Carol, thank you so much. Alex, as long as you're better, that's all we need. You guys, Kim Thaler, I love you too. So does anybody have any questions for me, that was on your mind? Don't be afraid of it, folks. Don't be afraid of getting it. Just not even prepare. Do what you can to protect yourself. Wear that mask. Thanks, Hope. I have the support of Lift family, past and present. Stay strong. And Paula Carlson, you've always been a fan. You've always been a supporter. I love you to pieces. You have no idea. And Shirley, thank you for the Bible verses. And that's true. That's my favorite. I can do all things through Christ who strengthens me. Larry Cote, love you, man. Hans Phillips, there's a spiritual guy that coaches at the highest levels and takes people, gets them on that path. I appreciate what you do. I told Gordy Jesper, I told my brother I want to sing Girl Can't Help It, because that's one thing when I get home, how I'm going to rehab my voice again. I'm going to be singing for you guys. And I'll sing whatever you want if I have to learn it. All right. Uh, okay, I'm going to sing with PF Flyer as soon as I can, guys. Believe me. Oh, boy. So, do you think you got it from the grocery store? Well, Burke, check out the earlier part, and the very first part of this, I talked about where I think I have no idea where I got it. Chris, Kathleen, thanks for reconnecting. Serena, semper fi to you too. And thanks, Kathy, for doing that. Hi, Joan. Um, Stephanie, thank you. And I'll sing Sticks for you again. Marilyn, for when you realize, first symptoms when you realized it could have been COVID. I think it was the headaches and body aches combined with the extreme fatigue. That's what did it. That's what did it. My teeth didn't hurt, Helen. Helen Robinson Blake, that's a friend of mine. My teeth didn't hurt, but my head, I had a really throbbing headache and then body aches. Jolie Leischel Allman, she has helped me. She's one of my health coaches, amazing health coach. If you haven't, check her out. When people say this is BS, how do you feel about that? Well, I say a lot of people don't take it seriously. That's why they don't wear masks. They don't social distance until you get this thing and it kicks your ass like it did mine. You might not take it serious. But once it grabs you, it's a killer, man. It's the worst. It's the worst I've ever felt in my life. So I don't wish it were on my worst enemy. Take this damn thing seriously. Did I have the chills? No, but I had fever. I forgot about that. I had fever off and on. I took Tylenol. It would take it away. They told me to take Tylenol. The fever came and I haven't had a fever. I think yesterday, I woke up to a thermometer in my mouth and it was around 100 degrees, 100.2 or something like that. So, yeah, it's, yes, indeed, Aaliyah, of course I will. I support people like you and your new business, your cosmetic business. I will continue to. Let me know what I can do for you. How long ago did symptoms start? 2 weeks ago today, Katie. And thank you. Helen Robinson Blake said, this is serious. Yes, it is. Don't downplay this thing. It's real. It's out there. People are getting it. It's continuing to spike. There's people that say, I don't want to hear the statistics. Well, you damn well better start listening to some. You might not believe the mainstream media, but I would take and listen to it all. I would listen to it all. You know, mainstream media, I don't give a shit if you listen to Fox or if you're listening to, don't listen to just one. Don't just watch Fox all day. Don't watch CNN all day, MSNBC all day. Watch it all because you're going to extrapolate, you know, the mainstream media isn't all bad, folks. They're not all lying to you. I don't understand where this shit comes from. You know, where they're saying, oh, they're just misreporting. A lot of the information on there is good and nobody really knows. So they're trying to do the best they can. Yes, do they fear monger? All of them do. They all fear monger because it gets ratings. It buys advertising, right? I get that. But there's also good, hard information on there that if you're smart enough to extrapolate, you're going to get something out of it. Like wear a mask, you know, stuff like that. Wash your hands a lot. Stay away from things. I'm sorry, guys, I'm not letting anybody in because I only have a couple of minutes and then my nurse is going to come and make her round. So, Nick Kustis, thank you for your support and for sharing my stuff and everything. I just want you to, you know, just stay safe. I don't want you to get this thing. I was the last person I thought I would get. I'm in, you know, good shape. I work out. I'm relatively strong for my age. I'm in, you know, for a 60-year-old, I'm in better shape probably than most. Maybe that's not true, but I'm in pretty good shape for my age. And I never thought I'd get this, but that's what everybody says. So it's, you know, hi, Jeff Minetto, my buddy. Nice to see you on here. Clarissa, yes, just keep doing what you need to do. seeing if there's any other questions you have. I hope I didn't miss any. If I did, just re-ask them on here. And when I have, you have to get better. Only 4 more years until my 70th birthday. Yeah, I got to work on your routine, Dale. That's right. You just need to get your rest. Love you, bro. Love you too, Terry. It's so good to reconnect with you. And thank you for saying I look good, because I feel like shit. Thank you for being so honest and sharing. Janet, I miss singing with you. Yeah, Jeff, I think I do. I've always tried to keep that up. So trying to stay positive. And hi, Craig. Nice to see you. I'm sorry I couldn't bring you guys on camera, because I just wanted to give this little update and tell you how I was doing. Thank you, Amy Kemick. Prayers and blessings to you too, and everybody that sent those to me. Joey Kennedy, will you remain contagious for a while? Yeah, from what I understand, I asked them about that I can remain contagious throughout having this entire thing. Usually with a virus, you're contagious, or an infection maybe for a week, a few days, and then you're still sick, but you're not contagious anymore. From what I understand, you can stay contagious through this entire duration of your sickness. And I'm not sure even afterwards, because right now they're saying even if you're testing for the antibodies and you're asymptomatic, you might not be immune. And there is nothing saying right now, from what I understand, that you cannot get it again. So just because I had this once does not mean I have built up an immunity to it. They don't know anything for certain. They're studying the behavior of this virus, and it's really weird. It's all over the map. It's a respiratory virus, but why is that causing diarrhea? They check me daily for stomach pain. They give me a daily shot in my belly to prevent blood clotting in my stomach. So there's all kinds of other stuff. They're trying to track the behavior of how this thing works. And Gail Page Walsnut, thank you, sweetie, for being so supportive of me. I appreciate it. But they're trying to track the behavior of this thing, and it's really weird, and it affects different people differently. There are certain things that you're going to have, the fatigue, but why they call it a respiratory is very similar to SARS, and that's if it affects your breathing, and then that's a pulmonary thing that can affect then your heart and everything else. So that's why they treat it like they do, and it's a scary thing. It is definitely a scary thing. People present differently. Tom Hanks, I thought I had it like him, but then I started developing the pneumonia, and I never thought I was going to do that. So I just know I'm going to be okay, and when I'm not okay, I turn to Facebook. I will keep you updated on my progress. You all deserve it, because you have been there for me. You have been there for me. And you'll never know what that means to me. You'll just never know. You saved me as much as anybody, as much as any of these doctors and my nurses have done emotionally, which I think is just as important, if not more. You saved me. So thank you so much. Okay, well, if anybody has one more question, Justin, you're amazing. Justin Andrew, thank you for saying that. But you're just as amazing for being there for me. You're welcome, Frank. And Nikki, thanks for sending the prayers in. Thank you for your love, your positive thoughts, your encouragement, your hope. That sustains me. Sam Martin, God bless you too. Lisa Ann, God bless you. Thank you for all this. You guys, if I could ask that, not to kind of PM me unless it's absolutely necessary, because texting kind of wears me out, and I'll still give the hearts. I try to do them, a little bit at a time when I have that time. And I'm sorry I can't comment right now, but Josh Burr, thanks for your time. Get better. I love you guys too. So I'm going to rest. And Chris, thank you. You're just as much as an inspiration. I'm going to rest now. And thanks for tuning in. And I love you all. You have no idea. So keep the faith. Just do me a favor. If you want to give me one gift, protect yourself. Just protect yourself. It would break my heart if any of you got this. It really would. But if you do, I'll break my neck to help you. And I know I can't be there with you, but emotionally, I'll coach you. I'll do whatever it takes. You've been there for me. I love you guys. You take care of yourselves. Thank you from the bottom of my heart.